Okay, so BSI, PPE is my scene safe. Yes, your scene safe. And NOI, MOI, I know I have a 35-year-old male who has just passed out. And number of patients, still one. I would call ALS and consider C-spine. So walking onto scene, my first impression is a male sitting in a seated position, seems to be alert, is tracking me as I walk in, has normal chest to rise. So I would go ahead and introduce myself. Hi, my name's Taylor. I'm with EMS today. How you feeling?
I'm not feeling too good.
You're not feeling too good? Passed out today?
Yes.
Okay, and someone called for you, or did you call yourself?
Yes, I called myself.
Okay. And I would go ahead. Oh, so I'm going to ask you some questions here, and just give me your best answer, all right? Okay. So do you know how old you are?
35.
35. And do you know what time of day it is about right now?
About 10 p.m.
Okay. And do you know what month we're in?
March.
Okay. And could you tell me who the president is right now?
Donald Trump.
Okay. So I would say they're ANO times 4. And I would... Okay, so Chief Complaint. So we're here because you passed out, is that right?
Yes.
Okay. So is anything hurting today?
My head's throbbing a little bit.
Your head, okay. So did you hit your head when you passed
No.
out? No? You didn't hit anything?
No.
Okay, just your head's hurting a little, throbbing? Okay, so I would say they're talking to me, their airway's clear. I would go ahead and auscultate. So is it okay if I put this on your chest to listen to your lungs?
Yes.
Okay, so go ahead and auscultate. And then I'm going to go ahead and check your heart rate through your arm. Is that all right?
Yes.
If I can listen to that. And then while I check circulation, look for skin signs. Okay, and I'm going to go ahead and put this on your finger so we can learn a little bit more about your body there. And now I would say... treatment, I would suggest a non-rebreather mask at 15 because they did pass out. I just want to make sure they're getting the right oxygen, and I would suggest that they do get transported to the hospital. And so we'll go into my history. So when did this happen? When did you pass out?
About 30 minutes ago.
Okay. And do you do anything to make your throbbing in your head better or worse? Do you sit in any position to make it feel different? No? All the same?
Yes.
Okay. And can you describe that pain to me?
It's just a throbbing in my head.
Yeah, throbbing. Okay, perfect. And does that throbbing move through your body at all?
No.
Or is that just staying up in your head?
Just in my head.
Okay. And can you tell me on a scale of 0 to 10, 10 being the worst pain, what does that throbbing feel like?
A 1 or 2.
Okay, so 1 or 2, not too bad. And has this ever happened to you? Have you ever had passed out? No pain in the head like that? Okay. So do you have, I'm going to go ahead and ask you about some history here. Do you have any allergies?
No.
No allergies, no seasonal allergies, nothing, no allergies, medications. Okay. And do you take any medications? Have you taken anything, maybe your medication or someone else's medication today?
No.
No? Okay. And when was the last time you ate or drank something?
About 4 hours ago.
Okay, so a bit ago. Okay, and have you had any big medical procedures, any strokes, any big medical things happen to you recently? No, nothing. Okay. And right before you passed out, what were you up to right before that? What happened?
Just watching TV.
Okay, so just sitting, watching TV. You didn't exercise this morning?
No.
Nothing? Okay. So my secondary assessment, I would say that I would go neuro and muscular. And then I would go ahead and check their vitals. So is it okay if I put this blood pressure cuff on you?
Yes.
It's going to squeeze your arm? Okay. And then squeeze your arm and it'll tell me a little bit more. So then I would go ahead and check their respiratory rate, pulse rate, all their vitals, blood pressure. And my field impression is that 35-year-old male, I would say, who maybe hasn't been eating or drinking much, possibly maybe stressed, and passed out. And then I would, for interventions, I would go ahead and check to see if my treatment has been working. So if they got their vitals to a better position, and then I would go ahead and reassess them every 15 minutes because I don't think it's a critical patient. And then as I hand it off to the nurse, I would go ahead and tell them, this is Jamie, 35-year-old male who is passed out after just watching TV. Maybe hasn't ate or drank that much today. No allergies, no medications. This hasn't happened before. And those are the big things I tell them.